Okay, so with that, we are going to jump into our, no, hold on, our panel. And these are three parents who have all kids with SJIA-LD or MASPAP. And we'll start with Anna telling her Sophia's story.
Good morning. Rashmi asked us to kind of pull together a short timeline of what's been going on with our littles. So my daughter Sophia was diagnosed just after her first birthday. She had kind of the typical rash fever pattern that we chased for a little while. And when she was diagnosed, we put her on steroids and Alaris, and that seemed to kind of keep her in control, but she made it about 4 months before she had some breakthrough symptoms. So we increased her Alaris dose. It seemed to be okay. 2 months after that, she started, in hindsight, we know that's when the ILD started, but she started with this dry, hacky cough that wouldn't go away. We thought it was pneumonia. We x-rayed. We did antibiotics. We kind of did the whole, scheme thinking it was just pneumonia. Once that started, 2 months later, we had her first CT, her first, second, third hospital admission. And with that CT, it showed that she did have interstitial lung disease. And because she was, once again, sick at the time, we opted to not biopsy her right away and wait until the infection had cleared so we could have a better sample. 1 month following her ILD diagnosis is, we call it her big sick. The movie came out right at the same time with Still's disease, so it was kind of, we called her big sick. Really, really sick. She had, we did an at-home overnight pulse ox study because the dry, hacky cough just wasn't going away. Her SATs overnight were in the 80s. Her heart rate was creeping up to the 200s. And so we admitted her again and started with a bronch. And she didn't tolerate that very well. She bronchospasmed, and we ended up intubating her. And that was the start of her 100-day stay in the hospital. She, her lungs just fell apart very, very quickly. Probably 3 days after her bronch and her intubation, we put her on ECMO because she couldn't tolerate it anymore. So she spent 2 weeks on ECMO. She was finally able to come off, but it was bad timing in that her body was so weak. When she came off ECMO, her cytomegalovirus reactivated, and that's what triggered her big MAS event that really was rough on her lungs. She, her ferritin at that peak hit 280,000. Her D-dimers were in the high 30,000s. All of her organs started to shut down, her heart, her liver, her lungs. We signed a DNR. We sat by her bed and waited. And this amazing little kid figured out how to come out of this big MAS event, but her lungs were so damaged from this whole event that we trached her. She has a trach. She was vent dependent from that point on. I think what was the biggest help for her pulling her out of this big MAS event is she did the whole HLH 10-week etoposide event. And so for her, that's what she needed to pull her out of her big MAS episode. And for the next few months, she was sick. She was in the hospital. So she spent 100 days total for her big 6 day. And then once she was released and went home, it was just kind of this constant respiratory battle, and that's still her problem now. Every time she gets a respiratory infection, it's almost guaranteed. It's a hospital admission. She just can't do it on her own. So at home right now, she's on oxygen all the time. Her levels fluctuate from maybe a quarter liter to when she's really, really sick and she's back inpatient, she's back up to 20 liters. She's back on the vent. We have to increase her settings. And so it's just, for us, it's this constant battle of trying to keep her healthy with being on all the meds that she's on. And so that's the biggest struggle for us. We did do a lung biopsy about a year ago on her when she was finally stable enough and healthy enough to do it. And the results that came back is that she had macrophage cells and T cells in her lungs. But I think what's unusual for us is right before that biopsy, her labs are fine. And I think that's where she's kind of an odd little kid. Her labs generally are okay. When she gets sick, they kind of creep up, but they never get to significant levels. But she has active inflammation going on in her lungs. So when we did the biopsy, we bronched her right before, and everyone was completely shocked that her lungs were, her carina was completely inflamed and red and thick. And everyone thought, well, how is that happening? Her labs look fine. And I think that's kind of an ongoing trend. When she gets sick, she's back in the hospital. We have to increase her oxygen. We have to increase her vent settings. I think that there's just active inflammation going on all the time. She has a really hard time moving her lungs. And so once she hits that peak in the hospital of needing extra help, she comes down fairly quickly back to her normal baseline. So that's her ongoing struggle. She has been on, she was on CellCep for a few months, and that really seemed to slow down her lung progression. But we had to take her off in August because she was neutropenic. It had totally wiped out all her white blood cells and her red blood cells. So she is off CellCep right now, and she's on probably her second week of Xeljanz, hoping that that's going to be the right one for her.
Emily. At the end, we'll have plenty of time for questions. So, or maybe do you have any clarifying questions about the story?
Just you said that the labs were fine. Are the ferritins normal, or do ferritins go up and do they correlate with the lung disease?
They don't seem to correlate. Her ferritin usually hangs around less than 100, and so it's not significant. Yeah. We don't test very often, but let me look real quickly. I wrote that down. We only test her LDH when she's inpatient, and she's between like 600 and 1200.
Is she, is she on vent
She-
constantly?
When she's healthy, no. She's vented when she sleeps. When she's awake, she doesn't need it. But when she gets sick again, then she ends up on the vent 24/7.
So she has a trach.
She has a trach, yeah. And she has a G tube also because of all of the meds. And she had an oral aversion from being intubated, so nothing was going in. So trach, G tube, vent, oxygen.
And how much do infections do? And is it bacterial or viral? Or do you have to send
It's kind of the normal kid viruses. It's like the human metapneumo, it's RSV. It's nothing crazy. It's just regular kid viruses, but she just catches everything. And you can almost guarantee it. She's going to end up back in the hospital. She's sick right now. She has a head cold, and she has more lung secretions, and so I'm kind of just waiting. It's coming.
I'm so sorry. So besides before CellCep and now Xeljanz, she hasn't been on any like ongoing treatment for the current.
So she's on IV steroids, which we kind of are doing double duty, hoping it's for her helping with the lung inflammation and trying to keep her SJI under control. But lung specifically has been CellCep and Xeljanz.
Thank you.
She's always been on oral steroids, and IV steroids have been around for probably a year and a half. She's on 0.4 mils. So the oral steroids are pretty low, 4.4 mils BID. So they're pretty low, but we can't get it past that. IV every 2 weeks, 450 milligrams. Mm-hmm.
Hi, everyone. So when Rashmi asked us to try and summarize 4 years in 2 or 3 minutes, you can imagine I have a notebook here. So Veda's 6 now. She was diagnosed 4 years ago when she was about 2.5 years old. Like others, it started with fevers and a rash that was mistaken for some kind of virus in the beginning. She was admitted, and within 4 days, we had our diagnosis of systemic JIA. We spent the next 6 months failing Actemra injections and trying to wean the 800 milligrams of anakinra daily that she was on. But every time we would try and come down on anakinra, she would flare. We added cyclosporin and methotrexate and tried to switch to canakinumab, which she failed over the next 2 months. And that was the first time that we gave in and tried steroids. Our rheumatologist tried so hard to keep her off of them. July 2016, we began steroids, and we've never come off of them. We tried Actemra infusions, hoping that maybe the sub-Q injections just weren't enough, and failed that on her 3rd infusion when she had some kind of reaction. They labeled it as anaphylactic, but we've spoke that it's kind of a different reaction. It was around this time that we were sent from Minnesota to Cincinnati for a second opinion, and that was, again, July 2016. We were told there that she had likely been having many episodes of MAS, and it was the first time that we looked in her lungs, and there were some definite abnormalities in her CT at that time. 1 year later, so July 2017, we went back to Cincinnati for a follow-up, and her lungs had significantly worsened. And that's when we became suspicious of PAP, and we began mycophenolate at that time. A month later, we did a lung biopsy back in Minnesota, and a bronch and PAP was confirmed on the biopsy. So after that, still we're like ebb and flow with steroids and anakinra dosing and cyclosporin, methotrexate, Orencia, Celebrex. Gosh, the list goes on, honestly. She's on over 10 medications right now. 9 months later, which would bring us to May of 2018, she was admitted again for MAS. They dug and dug to try and find a trigger for it, and they feel confident that it was triggered by a CMV virus. We've been trying to decrease steroids and antivirals for over a year with no luck. Every time we wean the antivirals, the CMV load is detectable again, and she's symptomatic as well. And so really, the reality is, I fear we've kind of run out of options for Veda. She's very different from Anna's Sophia in the sense that she has all of the systemic symptoms and very, very little other than clubbed fingers. You would never look at Veda and know that she has a lung disease. But right now, she's just on this cocktail of meds, and it's not sustainable. Steroids are not an appropriate treatment for our children, and our kids cannot come off of them. Veda has significantly fallen off the growth charts. As a baby, she was always topping out growth charts at 70, 80, 90th percentiles. She just fell to the 3rd percentile for her height, and she also recently had a compression fracture from a simple fall, and we know that that's due to steroids. And as we all know, her other organs are at great risk, and it's taking a dangerous toll on her little body. So we're here in hopes that there is something better. There's got to be something better than steroids and biologics at this moment.
Is she growing at all?
She has grown just under 1 inch in a year.
So you need to give me a perception of the glucocorticoids dose she's on. You said you're trying to wean several.
Yeah, so we were down to 10 milligrams. She's about 50 pounds. We were down to 10 milligrams a day, and her ferritin so when we're in acute MAS episodes, her ferritins are in the 8,000s. Her ferritin always sits a little high. Like I'm looking, this is our rheumatologist, so I keep looking at her. If I have a wrong number, fix me. But her ferritin always hangs out high. Last week it jumped from about 400s to 700s, and yesterday it was at 1,700. We cannot go below 10 because of lungs. So we literally cannot come off of steroids. We can't even try because at this point, because of the reoccurring CMV, when we would decrease antivirals, the CMV would come up, and the thought process from infectious disease is that we have her too immunosuppressed to allow her body to fight off the CMV. So some kind of immunosuppression had to go, and they chose mycophenolate.
Yeah, so it's a very difficult balance
Mm-hmm.
controlling inflammatory process and then not letting the CMV develop.
Yeah. Yep.
Have IL-18 measures been leveled, and how high are they?
So-
And are there free IL-18 levels?
That's not something that we started measuring at the beginning. We did provide a sample at the family SJIA. So the only thing I know is that her IL-18 in July, end of June, was just over 45,000. But I don't have a trend with that.
Total, we do not measure everything. And it was actually exactly at that moment when I thought that CMV was getting a little bit out of control, right? So then
She hasn't had a good year since October of last year. It's just, she hasn't had a good 4 years. But
IL-18 binding protein continue to the 2 is it low?
the only thing we do in Cincinnati is still on I don't think we ever send you samples to Switzerland.
mm-mm.
We do have them, correct? Like this, yeah. So I think,
Send, right?
yeah, yeah.
So do you still send your samples to Switzerland?
Yeah, I mean, we haven't pushed to develop the assay, and the reagents are proprietary, so it's been a little challenging to get that done locally. But Chim's usually very responsive to whatever we send. Usually just runs.
Any other questions?
It was high in June when we saw each other? Yes.
I've never heard the results.
Well, it's high. I think Grant sent you a letter yesterday morning that we can
Okay.
with the numbers. CXCL9 was high.
Yeah.
Actually, it's
Do you?
in my email.
Do you know? She has it. Look.
You have it?
Correct. Ours are consistently about tenfold higher, which is probably because we run it at a lower dilution, but the R-squared value is like 29.5. They're really, really close.
Yes, our values are very. In fact, we did repeat.
Did you find?
Trial. We
Yeah.
did a couple of samples in both places,
Yeah.
and the numbers are very.
So we are higher than the normal. Testing before we are higher, also higher than yours. Not tenfold higher, but twofold higher. Just make things more complicated.
Yeah, it's not a great analyte.
You use the
We buy them from feeds from
so we're using different tests. You use the
but that's the same.
What did you find out?
146. Okay.
Right, and it should be less than 30.
Yeah, less than 30 is normal. Moving on to Regina.
Hello, good morning. My name's Regina Minerva. My daughter Juliana is 3. So Juliana's story began in summer of 2017. At 13 months old, she was admitted to Cohen Children's Medical Center in New York. She had 15 days of fever, rash. The fever was between 103 and 105, would only break with Tylenol and Motrin, and then once the dose wore out, the fever would be back up again. We were inpatient, in and out, between July and and we started steroids. She continued to have breakthrough fever and rash, and on September 1st, 2017, we started anakinra, which seemed to be a miracle drug for her. The fever stopped, the rash dissolved within 24 hours, and she was doing great. I will say that she's our first child, so we actually didn't know what great was. She was just learning to walk right before she was admitted to the hospital. We think she was probably going to take her first steps around that 13-month mark. She didn't start walking until shortly after. Talking about the same, so she really couldn't express what she was feeling or, how the disease was, affecting her. But we continued on. She was on steroids, outpatient. We started at 5 ml twice a day. We were still coming off a regimen of aspirin from the previous Kawasaki disease, so she was on a cocktail of a few different things. And from September 2017, we began to decrease steroids. She was doing fairly well. We hit a bump in the road. She had a small, common kid cold. And in January of 2018, we realized that she was allergic to Augmentin, so it landed us back in the hospital with a major drug allergy, and then we had to increase steroids back to 7.5. So from there, we were on a slow decrease, and we began to have some breakthrough symptoms. So she started off having more rashes. She started off having nightly fevers around 7 p.m. like clockwork. We noticed she would have labored breathing during her naps. She was always flush. And, we just didn't realize that this is not what it was supposed to be like. It's not through the doctor's appointments that I learned about refractory. It was actually networking with other parents saying that this isn't really working. I hear these stories of kids, managing their disease. I didn't feel my child's disease was managed. In spring of 2018, we started to notice her fingertips becoming red, like it seriously inflamed to the point where they looked like they were in pain. Her toes looked really inflamed. We would, investigate, and I looked on the SJIA group, and I managed to run into the stories of these ladies here who warned me about clubbing and lung disease. And it scared me. It was denial. This is a club that no one wants to be in.
Yes,
And the Club Fingers Club.
the club finger.
And, every visit with the rheumatologist, her breathing was clear. She had no symptoms of lung disease. There was no reason to check, to have a chest x-ray. There was no reason to have a CT scan. She was behaving normally. So we had been tapering the steroids. We were very successful in tapering steroids, in our opinion. I mean, she was down to alternating 0 and 0.5 every other day. We were doing well, and then all of a sudden her fingers didn't just become red, they started actually, I call them popping. Like one by one, her toes went first, and they became incredibly bulbous and swollen, and then her fingers went as well. And at that time, looking at the labs that I now understand what they mean, I didn't at the time. Her ferritin levels were about 3,500, climbing to 4,600, and that was in September of 2018 when her fingers finally made that change. And that's when it was visible by her rheumatologist, and we went in for a chest x-ray, which showed opacities in the lungs. And it took some time. So she was having breakthrough symptoms. Again, no breathing issues, no reason to suspect lung disease other than the fingertip and toe clubbing. In November of 2018, that's when Juliana first had visible active arthritis, and it presented in her knees. It started out with a slow limp, and then it got to the point where she was bedridden. We ended up giving her a steroid injection into her left knee, and that seemed like an immediate problem solver. But that time of being from about Christmas through about Groundhog's Day, she was pretty much on her back, and she had muscle atrophy in her leg. We then started a regimen of physical therapy, and we added an occupational therapy because we didn't know how the clubbing was going to affect her digits and her ability to write and do normal things. So she's been on that ever since. And we had a chest x-ray. It took a little bit of time to get it. She's 3. We thought she'd have to do it under sedation, but she's a warrior. CT, yes, I'm sorry. We thought she'd have to do it under sedation, but she's a warrior, and she stood still.
That's
And
the one in May 2000.
so in May 22nd, 2019, she had her first CT, and that's when we had the official diagnosis of interstitial lung disease. So it's relatively new for us. She has not had a biopsy or a bronch at this time. So that was May 22nd, and her ferritin levels around that time were about 1,500. They were starting to smolder. We had actually come off steroids completely in March of 2019. And at that point, I thought we were on our way, to coming into this remission that everyone talks about. Her ferritin level was down to 190, but again, I'm sorry, up in May it started creeping up. And her physician said, I think she has some smoldering MAS that we need to tamp out. And that's where things started changing, and things got a little bit cosmic, as I'll say, because we signed up for the family conference, which was scheduled for the last weekend in June. We had decided to take up the opportunity to have a second opinion, and we were all set to see Dr. Schulert, and we had sent over all Juliana's records to have this second opinion done to, evaluate. And then by the middle of June, her numbers started to skyrocket, and Juliana went into full-blown MAS. It was her first official MAS episode, though most of her numbers were really high for most of her SJIA life. Her ferritin levels had never really, stabilized. None of her levels had really stabilized. But it shocked me because that day in the ER on June 22nd, her ferritin levels were up to 30,000 and climbing. So we were admitted, we started pulse steroids, and that was the week leading up to the Cincinnati conference. So I said, we need to get to Cincinnati, I want to see what's going on. And her numbers, they fluctuated. It's like we were seeing a little bit of progress with the pulse steroids, an increased dosage in oral cyclosporin. We switched over to IV cyclosporin, and her numbers just kept on rising. And at that point, I was a desperate parent. We will do anything to save our children. And, this community that is formed by Leah, this SJIA Facebook group is like talking to friends who actually know what you're talking about. Family can be there for you, but they have no idea when you hear these numbers what they mean. So I took to Facebook, and I said, my daughter's in the hospital with MAS, and usually it comes with, well wishes and prayers from around the world and people who actually know what you're going through. And this time it wasn't just moral support, it was outreach of people telling me what I need to be aware of and how bad this could get. And I know Anna's story, I know about Sophia, and I know about Veda, and they predated me with this diagnosis, but it was very real, and it became very real in that moment. And Rashmi had reached out to me, and it was at that time that, it was the advocacy of these parents that I believe helped to save my daughter's life, because they told me about the clinical trial for imapalumab, and it was once that she was failing all clinical methods to combat MAS that we decided to have her transferred to Cincinnati. Beth Gottlieb was phenomenal in helping us to make those moves. We received wonderful treatment there, but there's only so much that the regular drugs can do. So we arrived at Cincinnati Children's Hospital. She was medevaced in a really small airplane in the middle of the night. This 2-year-old girl who just spent her 3rd birthday in the hospital, I thought she was going to die on her birthday. And we arrived with optimism, but no guarantees. And I will say that within 1 hour of receiving her imapalumab infusion, she sat up after not eating for a week. She asked for pizza. She asked for chips and soda with a plate and a fork. She was drinking milk out of a bottle like a baby. For a week, they talked to me that morning. They said she might have to go on a G-tube. And here she was coming back to life. Her ferritin before we started was at 75,000. The day before we were at Cohen's and it was at 40,000. So overnight, it just kept on going through the roof. And I really feared the worst. I was 29 weeks pregnant, and I dropped everything and got on that plane with hope that this would save my child. And there's no guarantees, but what I will say is we spent 8 weeks in Cincinnati. I'm from New York. Cincinnati was very hospitable. It was a real game changer for my daughter. Now, clinically, she is home. We got home the first week of August. She's continued to be followed by Cincinnati, by her rheumatologists in New York, and she's a different child. She's in remission from MAS, but she's now seeing normalized labs. She went for a follow-up. We've been following her every 2 weeks now as post-diagnosis, post-MAS. Her ferritin on Friday was 157. It's never been 157, never. She has more energy. I didn't know what a normal toddler was, and now I have a newborn, and I am exhausted. But it's miraculous, it really is. And there's more to be learned about this, things that I can't even comprehend. I've learned a lot about SJIA, a lot about MAS. I don't know as much about the lung disease because we were only diagnosed in May. But what I could say is we had a baseline CT done in May 22nd. She had her MAS episode in June. We'd consider her in MAS remission by the middle of July, and then we had a follow-up CT scan done on Friday, September 27th. What we could say is that there's been dramatic improvement. I'll just be honest, I don't know what any of this means. But what I can say is when the side-by-side of the 2 different images was put next to each other between May and September, I can even tell that there's improvement. I can see that there's not as much inflammation. And one of the things, we've been suspect of is getting the overall SJIA inflammation under control going to help the progression of the lung disease. And that's something I don't know, but I'm hopeful because numbers tell a story, and the inflammation numbers are down. So is that helping her?
Regina, what's happening with the redness around?
So I've been photo documenting, taking pictures of her fingers at least once a week. I bait her into taking a manicure, and then I take pictures of her hands. And it actually looks good to me. I mean, it's still there's still some redness. Like when we were there on Friday, there was some redness. But day to day, like there's some days yesterday I looked at it, and they looked great. Her toes are always worse. They're really bulbous, but the fingers seem. I mean, I don't know if there's actual improvement, but I see a side by side of, months ago, and you can definitely see they're less red.
Questions?
For how long was she on metalonine?
Can I talk about this? I'm gonna.
She was on the pump, but she was on the clinical trial. She was
Oh.
treated for 4 weeks.
And she had 8 infusions
8 infusions twice a week.
So this
for
wasn't
4 weeks.
clinical, this was on the trial.
on the trial.
On the trial. That was why she was moved to Cincinnati.
Yes.
Did the lung imaging improve?
Yes, yes.
That's the line. May 22nd, it's one
On the
month.
right.
How much?
Yeah.
It's 1 month before emapalumab. Sorry.
There's 3 images.
September 27 is not free.
Do we know what happened to the IL-18 lens?
So we didn't have IL-18 drawn before, but I just got it back from Friday, and it's at 24,000, and her CXCL9 is at 90. 90.
Can you remind us CXL9 levels at baseline when she started?
I don't think we had them. I don't know.
Well, they know that, yes, I remember. They wanted to, if you look at all the patients enrolled in the trial, she was just about the average level of 6.
So it was between 15 and 18, if I know the numbers. If I remember the number correctly.
Okay.
15,000, I think.
As you can see.
It's probably 15,000 or 18,000, something like that. I think I have the data actually.
The CXL9.
Yeah.
Yeah, it was in the normal range.
Now.
Now.
How much has arthritis been an issue in any of the 3 patients? None for you, but your daughter had arthritis
daughter-
one time, right?
Yeah, it took about a year and a half after diagnosis, and it's for us to see any arthritis. We were hopeful in also knowing this community that maybe we weren't seeing any active joint inflammation. It does affect just her knees.
My daughter did, at onset, have knee effusions, but really, on exam, not ever anymore.
Mine's never. Mine's systemic only.
She'll say, "I hurt and I'm sore," but she can't put a finger on it, on what hurts.
No questions? Just a few comments from me. I think what you hear about is that the parents have become, since there's several of us in the group who've gone through this, we know what can happen when a child with MAS and gets the lung issues, and when they go into MAS after that. It's, we've seen what Anna went through. And so we really have a network where by now, if there's any parent who says that I'm going into MAS, we kind of activate that network and we immediately reach out. And I remember the conversation that I had with Anna and one other parent when this was happening to Regina. And we said, does she know what can happen? And we decided as a group that she did not. So we called her and we said, things can get really bad when you put these things together. And that's what we do. That's how we try to help, is to kind of tell the parent to be aggressive, to ask for things, because I think this knowledge of how bad it can get has not reached every center. And it's hard for it too, because they might have one patient, but the parent group has many who've gone through this.
And pediatricians do everything they can not to scare us.
Yeah.
So, and we all understand why, but we don't know what questions to ask when those worst case scenarios aren't really spoken. Nobody wants to scare us and to make us panic. And so we don't know the questions to ask sometimes. So that's why the parent networking is so important for us.
And I'll just say too that they warned me of the dangers of organ damage. And speaking to the other parent, Luke, his daughter Lily is on continuous oxygen, and it was something that I realized was a possibility when we were leaving the hospital in New York. Juliana's SAT rates were like 88, 89. She left on oxygen, on Lasix. She was taking on fluid in the lungs. And, I thought, okay, this is it. This is what it's going to be like going forward. we arrived in Cincinnati, we started the trial, and she came off oxygen. So I'll just say that, and she hit some bumps in the road, but she managed to escape this episode, and she's not on oxygen at this point.
And as a group, I think it was a very big win for us, because we've seen, all of us have seen many parents go through this. And you're traumatized yourself by your own child, and then you live through the trauma. And for the first time, we saw a child come out of it without significant organ damage. So I think it was, for the whole group, it was a very big deal. I think we'll move on to the next session.